Welcome back. We have all things COVID-19 and kids in the vaccine with Cone Health's Executive Director of Pediatric Services, Dr. Michael Cinnamon. Okay, it was the $1 million day today. We found out the first $1 million winner in the vaccine lottery, but there's still a $1 million question out there. If this vaccine works so well, why are people who got vaccinated still getting sick?
There are certain people with the vaccine who can still get COVID. It's not 100% effective at preventing that, but usually the symptoms once you get COVID are very, very mild. And as we as a community unmask, we were all masked up in the winter. We had very, very few respiratory viruses being passed around. Now that we're unmasking, because the rates of COVID have gone down, and the CDC feels that for vaccinated people, it is safe to do so in most circumstances. We're starting to see other respiratory viruses. So people can get the old common cold and other viral infections that get passed around. So we're certainly not immune or protected from all of the things that we can get.
Okay, you mentioned the buzzword of the day, mask, because the World Health Organization just said because of the Delta variant, even people who are vaccinated should wear your mask. What do you think about that? Are you wearing your mask in public?
Well, we're following, again, in the United States, I think it's different than a lot of other parts of the world, and the World Health Organization is making statements that apply to Brazil and Europe and South America, all over the place. In the currently, the Center for Disease Control feels that if you are fully vaccinated 2 weeks after your second shot, that in most circumstances it's safe because of the data that I've already shared. The risk of getting seriously ill or being hospitalized or dying from COVID are approach zero, that it is safe. So I follow those guidelines myself when I'm at work, in the hospital, where we don't want to pass, we're in a healthcare environment, the rules are a little bit different. We still ask all our patients, their families, and all the healthcare providers to wear masks. So it depends on the environment. But, out in the general world, sometimes it's up to the store or wherever you are to create their own rules. But I follow the CDC guidelines, and they make sense to me.
I am so glad you clarified that for us, because I don't think we wanted to go back to mask land all the time. This Delta variant, how serious is it? Do we really need to be worried about it?
I don't know that we need to be worried about the Delta variant in and of itself. Again, there have been a variety of other variants that have appeared since we first discovered COVID and it became a problem over a year ago. The Delta variant is one of many. Viruses mutate all the time. That's normal part of the way it works for all viruses. It appears to be more contagious, and there are some speculation that the infection that it causes may be more severe, although I don't think that has been really fully agreed upon by experts, infectious disease experts. However, I do believe that people agree that the current vaccines that we are using are completely effective against the Delta variant as they are against all the other variants. However, if you're not vaccinated and the Delta variant is indeed more contagious, it becomes that much easier to get the infection and potentially become sicker with it. So another reason, I would say, strong reason I would recommend that people get vaccinated.
That's a great reason. Still a lot of parents on the fence. What's your 10-second pitch for why parents should get their kids vaccinated?
My 10-second pitch would be, you don't want COVID-19, even for your child. It can make them very sick. They can end up in the hospital. And even if they're not sick, they can spread it to someone else. There are still, in the United States, a large percentage of the population that is still unvaccinated. And we want to protect them too, if we possibly can. Then we can get back to doing all the things that we like to do.
Guys, let's get those kiddos protected out there. Go talk with your doctor today if you have more questions. Dr. Cinnamon, thank you so much for joining us.
Thanks for having me.
You can find all this later in the 2 Wants to Know section of WFMYnews2.com.